They were treating the state Medicaid system like a personal ATM, withdrawing millions while the government, well, it seems like they left the paying code taped to the machine.
It's actually worse than that. It's like the government held the door open for them, handed them a coffee, and then, thanked them for emptying the vault.
Welcome back to the Deep Dive. Today, we are looking at a story that is going to make your blood boil. And honestly, it really should.
It's a staggering situation.
We're unpacking a massive billion-dollar blind spot in New York's Medicaid system. And we are not talking about a rounding error here. We're talking gold bars, ghost patients, and a system so broken it literally funded its own robbery.
Right. It's a web of fraud that is so brazen, so open, that you have to ask if anyone was actually watching the store.
Okay, so let's set the scene. Just earlier this week, news broke about a huge bust in Flushing, Queens.
Right, the DOJ.
The Department of Justice charged two men, In-woo Kim, he also went by Tony Kim, and Daniel Lee. They're accused of running a fraud scheme worth $120 million.
$120 million. Just to put that number in perspective for you, that is more money than the entire annual budget of many small American cities.
And get this, they were allegedly turning senior care into a bribery factory.
That's the headline. But you have to understand, this isn't just one bad apple. This coincides with a scorching new audit from the New York State Comptroller, Thomas DiNapoli.
And he found, what, nearly $300 million?
Nearly $300 million in questionable payments. Plus, we have a whole separate indictment that involves, you mentioned them, gold bars and shell companies.
It's the perfect storm of corruption. So our mission today is to figure out the mechanics. How do you steal $120 million without anyone noticing?
And why did the state's oversight fail so spectacularly?
Exactly. And we need to look at the really uncomfortable questions raised by our sources regarding immigration, culture, and, what happens to taxpayer money in this new political era.
A lot to unpack. But if you pay taxes, you need to understand how this machine works. Because at the end of the day, you're the one paying for it.
Okay, let's dive right into the mechanics of this Happy Life scam. That's the actual name of one of the centers, right? Happy Life Adult Daycare.
The irony is clearly dead. Yes, right. The indictment focuses on In-woo Kim and Daniel Lee. And the way they physically moved that much money, $120 million, was by flipping the whole script.
What do you mean?
Usually when we talk about Medicaid fraud, we think of identity theft, right? Someone steals grandma's ID number.
Right, the patient is usually the victim.
But here, the patient was an accomplice. According to the DOJ complaint and reporting from the Western Journal, this was a full-blown kickback economy.
A kickback economy? So how did it work?
If a senior enrolled in their center, they were handed $500 in cash just for signing up.
$500? I mean, for a senior on a fixed income, that is a lot of cash.
It's huge. And if they actually showed up and used the services, the bribe dropped to about $300. But the real money, the engine of this whole fraud, was the pharmacy link.
Okay, so Kim owned a pharmacy.
He did. And they would steer these seniors to fill prescriptions they didn't need.
Wait, I need to understand the math here. If I'm running a scam, why am I just handing out $500 bills to people? That seems like a pretty good way to go broke.
Because you have to spend money to make money. This is the key insight. The daycare was just the storefront. The real product was the prescriptions.
And they focused on what, pain patches? Why those?
Specifically, diclofenac epolamine pain patches, because the markup is just insane. Kim would bill the government, meaning you, the taxpayer, $525 for a 60-pack of these things.
$525 for a box of stickers.
Exactly. So he bills the state $525. He gives the senior a $100 cut from that. The senior takes the cash, maybe throws the patches in the trash, maybe sells them, who knows. And Kim pockets the massive difference. It's almost pure profit.
So everyone's happy, the senior gets cash, Kim gets rich.
And the taxpayer gets a bill for medicine that nobody ever needed. It's an assembly line. This wasn't healthcare, it was a transaction.
And the lifestyle these guys were leading. The sources mentioned Kim had a $1.2 million home on Long Island.
And Lee, his partner, had a serious gambling problem. The investigation showed he withdrew $124,000 at a casino in Yonkers.
Unbelievable.
These weren't men struggling to provide care for the elderly. They were living like kings on public funds.
There was one detail from the text messages that really stood out. The DOJ released them.
Oh, yes, that text is damning. He wrote, "Please give $10,000 to the Korean members first."
To the Korean members first.
It shows a very specific targeting strategy. They were leveraging their own community. They used language barriers and cultural trust to build a criminal enterprise.
So you have seniors who are supposed to be getting looked after, but instead they're basically just mules for Medicaid billing. Is this just two guys in Queens, though? Or is this bigger?
Oh, it is much, much bigger. If we look at the broader picture, we have to talk about the Zakia Khan indictment.
Right. This is the Happy Family Network. Another one of those ironic names.
See, exactly.
Mm-hmm.
This indictment was filed in March 2025, but it connects directly to what's happening now. And the con ring, it shows this is a multicultural fraud network. They even had their own vocabulary for it.
They had code words, like in a movie.
They did. In the wiretaps and texts, they referred to the cash bribes for Medicaid recipients as bread.
Bread.
As in, did you give the members their bread? It sounds innocent until you realize they're slicing up millions of dollars of our money.
And they laundered it.
Oh, yeah. Khan and her partner, Ansir Bassi, used a whole web of shell companies to wash the money. And when authorities finally raided them, they didn't just find cash.
This is the gold bars part, right? I read this. They found actual gold bars.
Actual metal bars, along with luxury jewelry and a 2024 Mercedes. This is a crucial takeaway. They weren't just stuffing cash under a mattress. They were converting these digital Medicaid payments into hard assets, gold, cars, as fast as they possibly could. They knew they had to hide the wealth.
And the ghost patients thing, that really gets me. This connects to something called CDPAP. Can you explain what that is in plain English? Because I think a lot of people hear these acronyms and their eyes just glaze over.
Sure. CDPAP is the Consumer-Directed Personal Assistance Program. And the idea, it sounds nice on paper. Instead of the state sending a nurse to your house, you get to hire your own aide. It could be a neighbor, a friend.
Okay, so less government control. That sounds good in theory.
In theory, yes. But in practice, without strict oversight, it's just a black hole for money. In the Khan case, they were billing for care for individual one and others who weren't even in the country.
Wait, say that again? The taxpayer is paying for home care for someone who is literally overseas?
Correct. The patient is on vacation or visiting family in another country. Meanwhile, the meter is still running back in New York. The public is paying for a service that literally cannot happen.
Which brings us to the big question. Where were the regulators? I mean, how does $120 million walk out the door without a single alarm going off?
That is where the New York State Comptroller's audit comes in. Thomas DiNapoli released this report just this month, February 2026, and it paints a picture of a regulatory body, the Department of Health, that was, well, it was essentially asleep at the wheel.
Asleep is being too kind. Let's talk about the terminated loophole. This sounds like a joke.
It's a bureaucratic disaster. The audit found that the state paid $285 million to providers after they had already been terminated from at least one insurance network.
Hold on. So a provider gets fired by an insurance network, maybe for fraud, and the state just keeps sending checks anyway.
That's it. And to be specific, $28.6 million of that went to providers who were terminated for cause. That means they were kicked out for things like fraud or abuse. But because the state systems are a complete mess, these guys just hopped to another network and kept billing. The money just kept flowing.
How is that even possible in 2026? We have AI that can drive cars, but the state can't track a fraudster who was already fired.
It comes down to a complete data failure. The controller found that the Department of Health's database doesn't even track National Provider Identifiers, or NPIs, for these daycares.
What's an NPI?
Think of it like a social security number for a business. Even if you change your name, your number stays the same.
Okay, I'm with you.
So if the state bans Company A, the fraudsters just change the sign on the door to Company B. If the state was tracking the NPI number, they'd see it's the same people. But New York wasn't tracking the numbers for these centers. They couldn't stop them.
That's just gross incompetence. It's like banning a bank robber from one branch, but letting him walk into the one across the street because he put on a fake mustache.
It's a pretty accurate analogy.
Okay.
And then there's the overcrowding issue. This one, it's almost comical in a really dark way.
The 530 people.
Right. The audit highlighted one specific center. The fire department said its maximum capacity was 323 people.
323 is the legal limit. Got it.
But on a single day in September 2022, they billed Medicaid for serving 530 members.
So either people were sitting on each other's laps or
nearly 200 of those people just weren't there. And the state paid the bill anyway. No one looked at the claim and said, hey, wait a minute, this building physically cannot hold this many people.
It's absurd. And the paperwork, I assume if you're billing for 500 people, you at least have 500 signatures, right?
You would think so.
Right.
But the audit checked a sample of claims. They found that 9% of them had absolutely no sign-in logs, no proof anyone was even in the building. It was essentially an honor system for thieves.
An honor system for thieves. That's terrifying. But it's not just the daycares, is it? The rot spreads to how these seniors even get to these places.
Exactly. The transportation sector, they call it NEMT, non-emergency medical transportation.
And I saw the report from 77 WABC describing these as basically taxis for Medicaid.
It's Uber for fraud. Take the Purple Heart case. It was a $19 million scheme led by a man named Sean Alley. He was an illegal immigrant from Guyana.
19 million. How did that one work?
Kickbacks and fake mileage. They'd pay patients for their ID cards, then bill for rides that never happened, or they'd just inflate the mileage. But the human cost here is horrific. There was a story cited by a state senator.
Oh, this story was heartbreaking.
About a patient seeking methadone treatment. The driver was supposed to take the patient to the clinic. Instead, he took them to buy drugs. They split the fare money. The driver kept half, the patient used the other half for drugs, and the patient overdosed and died.
So the state effectively paid for the ride that killed them.
They subsidized the overdose.
That is just sickening. It's not just money, it's lives. And this whole transportation system is locked down by one massive contract, isn't it?
It is. And this is where the politics get really messy. Governor Hochul awarded a $1 billion exclusive contract to a company called Medical Answering Services, or MAS, to handle all of this.
$1 billion monopoly.
And if you follow the money, well, the owners of MAS donated over $300,000 to Cuomo and Hochul combined. There was even a fundraiser hosted by the owner right before the contract was awarded.
It just smells like pay to play. You have Republican State Senator George Borrello calling it a billion-dollar boondoggle run by unaccountable brokers. It is really hard to argue with him when you see the results.
And it creates this closed loop, right? The political donors get the contracts, the oversight disappears because of those connections, and the taxpayers foot the bill for all the fraud that happens in the shadows.
So we have to address the elephant in the room. The sources we're looking at, specifically the Western Journal and 77 WABC, they don't shy away from pointing out who is committing a lot of this fraud. They link it directly to immigration and culture.
No, they aren't shy at all. And it's a crucial part of this whole conversation. The Western Journal explicitly argues that we are, and this is a quote, importing fraud.
Importing fraud. That's a strong phrase. What's the argument behind that?
The argument they make is that we're bringing in people from cultures where taking advantage of a government system isn't really seen as wrong. It's seen as smart. It's just, business. The source quote is pretty brutal. We do ourselves no favors in handing out money to foreigners only for state officials to turn a blind eye in fear of being called racist.
That seems to be the key right there. The fear of being called racist paralyzes the regulators.
It's a powerful paralysis. If you're an auditor and you notice that, say, 90% of a certain type of fraud is coming from one specific ethnic community, you might be scared to say anything. You don't want a discrimination lawsuit.
And so that community can become a safe harbor for this kind of crime.
We saw this with the fraud tourism concept, the Minneapolis precedent, where people actually traveled to the state specifically to exploit lax benefits. The implication is that New York is becoming a destination for the same thing. People aren't coming to work. They're coming to mine the Medicaid system.
But the tone is changing, isn't it? It's 2026 now. There's a new administration in Washington.
That is the major shift. We're in the Trump-Oz era. Dr. Mehmet Oz is leading CMS, the Centers for Medicare and Medicaid Services.
And his mandate is pretty clear.
Crush fraud. That's the quote. The federal tone has totally shifted. It used to be access at all costs. Now it's accountability, or else. You're seeing a new national fraud division ramping up.
So you have this clash. The federal government, led by Oz, wants to stop the bleeding. But the state government in New York seems stuck in this archaic, politically compromised mess.
It's a collision course. Legal experts, like the Norman Spencer Law Group, they note that investigations are getting aggressive. They warn providers that what might look like a clerical error is now being treated as organized criminal intent.
Which seems fair. Given the scale, $120 million here, $300 million there, it is organized. You don't accidentally bill for $120 million.
Not at all. When you have text messages prioritizing payments to specific ethnic groups, the clerical error argument just doesn't fly anymore.
So let's try to sum this up. We have a case in Queens. $120 million stolen by turning grandmas into bribe takers. We have a state audit showing $285 million paid to providers who were already fired.
And we have a transportation system that's allegedly killing addicts while donors get billion-dollar contracts.
It's a system that seems designed to be exploited.
It's a system that relies on the honesty of strangers. It's funded by the hard work of taxpayers. And it's managed by bureaucrats who aren't even looking at their own data. The federal crackdown is coming, but New York's internal systems are still just wide open doors.
You know, I keep coming back to that occupancy number.
The 530 people in a 300-person room.
Yeah. Here's a thought to leave you with. If a daycare center can bill for 200 more people than can physically fit in the building, and the state sends the check anyway, is the real crime the fraudster's greed? Or is the real crime the government's indifference?
That's the billion-dollar question, isn't it? Until the government treats that money like it's their own, the door is going to stay wide open.
Thanks for joining us on the deep dive. Keep an eye on your wallet, folks. We'll catch you next time.